Harjed Amavalmo, the nurse in charge. You've been with Alice to carry an assessment. How did the assessment go?
Yeah, so I went to see Alice Jones this morning on ED. We had a referral taken for this lady. I went to see her, but she was not engaging very well. She kept her body language quite close to herself, limited eye engagement, not really wanting to talk about much. When I asked about school, she didn't want to say much about that at all. She still lives with parents.
Okay. How was her personal hygiene like?
Well, her hair seemed to be brushed. Her clothes were quite clean. No obvious signs of self-neglect there. Doesn't seem to be eating or drinking a lot.
Yeah. Was she stable?
There was no hallucinations identified. She wasn't responding to anything. Just very limited and wanting to talk to me. Didn't want any input from ourselves.
All right. Did you take notice of her clothing?
Yes, they were slightly baggy. She wasn't eating or drinking. I couldn't see any signs of her clothes fitting her very well. It looks like she's lost a lot of weight, malnourished.
All right. Thank you. That has been very helpful. So also I'd like to know if you take notice of her behavior during the assessment.
Very anxious, very closed off. Didn't want to talk about how she was feeling. Didn't open up at all at any open-ended questions. She didn't want to delve into anything other than saying about she lives with her parents. Didn't want them to know. And just about that school. She didn't enjoy school.
All right. What about her speech?
She was quiet, but it was normal tone.
Yeah, that's fine. What about her mood and affect?
So she did not explain how she was feeling. She did present low in mood, shaking a lot, quite a bit of anxiety there.
Yeah. All right. Her thought. Does she have any? Do you have concern about her thoughts?
No expression of thoughts of ending her life. But she did not speak much about this during the assessment, or couldn't identify a trigger that brought her into hospital.
All right. Thank you for that. Was there any sign of auditory or visual hallucination?
No auditory hallucinations at this time identified.
All right. What about her orientation? Was she orientated to time?
She was orientated to time and place, yeah.
All right. That's fine. Was Alice able to have some insight and judgment into her condition?
She's not trying to leave hospital at the moment. She seems to have insight into her mental health, but she is currently in a safe place, so it's hard to know whether this would change when she leaves. She just does not want her parents to know anything about this. So I feel like we need to come up with a decision what's next.
That's perfect. Yeah, with the 6 P's risk assessment, I think there are a few things we need to consider. After that, then we're going to make a decision. What was our presenting factors?
It was noticed that she had self-harm marks on her wrist. She was weighing in with a median BMI of 77%, and her own clothes were quite baggy on her person.
All right. Well, I think other predisposing factor, was there anything?
Nothing identified at this time.
That's fine. What about the perpetuating factors?
She was struggling to engage at school, leaving others, quite isolating herself.
Yeah.
She describes herself as not being good enough for her parents. Her family may have high expectations of her. That's maybe why she doesn't want her parents involved in how she's feeling.
Yeah. All right. Thank you. Are there anything we could look into as precipitating factors?
Perhaps school and her family.
Yeah, that's good. What about protective factors?
She's got her family living with her, so
Okay.
that could be her support network.
That's fine. So, so from all we have gathered, it looks like if Alice continues to remain without intervention, her physical and mental health, they are at risk to a possible eating disorder, anxiety disorder, and low mood, which means that she could further deteriorate. So I think something needs to be urgently done.
Do you want me to make a referral in the community
That's
mental health
perfect.
services?
That would be great.
Okay, thank you.
You're welcome.